Doc, good morning, and thanks so much for your time. This is an area where you focused on for a very, very long time.
Yes, good morning, and thank you for giving mental health the spotlight, yes, especially in this time of the year.
So let's look at the common eating disorders, what you've noticed. I mean, worldwide, yes, they will be common, particularly in South Africa as well. What are the common ones that you've had to diagnose?
When you're talking about anorexia nervosa, bulimia nervosa, and binge eating disorders. And of the three, binge eating disorders is actually the commonest. But psychiatrists or mental health professionals see the list of that. So mental health professionals will largely see anorexia nervosa and bulimia, whereas binge eating disorders, they'll end up with the physicians due to medical complications like diabetes, hypertension, stuff.
So just give us a bit of an explainer. I mean, we all think we know what anorexia is, bulimia and binge eating. Just a little bit of and differentiate for us between them.
So I think effectively, if you think about eating disorders, there's two sort of cardinal features that one needs to consider. One is the excessive fear of weight gain with the behavioral pursuits that follow. Then it will sort of define what diagnosis you then precipitate to. And then the other most important factor is the preoccupation with self-evaluation that actually even overcrowds other important areas in your life. So self-evaluation in terms of looks, that is weight, shape.
Standing on a scale or twice a day, three times a day. Oh, I might be guilty of that. Yeah.
So those are some of the things that would preoccupy somebody that would then sort of then diminish other areas of their life. And so if you're thinking of anorexia, these will be people that are really quite disciplined and perfectionist in their trade, and they are able to pursue, say, for example, if they have a rigid rule around dieting, they would stick with that and for as long as they've reached the goal or even less than the goal that they've achieved. And also bulimia are those that eat beyond the point of comfort and then would follow up with purging as a mechanism to lose the food that they've just eaten. But what would have started, especially with bulimia, what would have started with the intentions to lose weight is usually overtaken by sort of emotions or life events. So say they get a breakup or some tragedy happens, then they then pursue the binging and purging in a sense, almost trying to I guess, contain their emotions or distress with that.
And then the binge eating that you spoke of, and you say that, you know, experts see very few of those cases until it becomes actually a problem. Why is that? Is it because, you know, people are not aware, it's not constant, it might be this way one week, then they might be different the next week? Why?
So I think, if you're looking at the technicality in terms of the eating disorders, the binge eating disorder in itself finds itself under the eating disorder banner because of the technicality related to food. But how they present is more around body dissatisfaction. And now, if you can think about it, if you've got a thick build, you might be uncomfortable with the way you look, but that might not necessarily make you psychologically disturbed, right? But what tends to happen is that because a lot of them then have comorbid psychological depression, anxiety, then that then also then exacerbate their relationship with food. Because how they then present is, unlike bulimia nervosa, where there's binging, which is followed by purging, they would binge at random times, and they would eat quite large quantities of food, even at times when they are not hungry. And that is how they would then gain the weight and keep the weight.
Okay, so that's very interesting, because we would have to look here at this point at the reasons why people do this. And you speak of the emotional reasons, like you say, they might be going through some trauma. When it comes to all of these, like anorexia, bulimia, binge eating and all of that, is it often just a case of body image? Is it that they are just unhappy with what they're seeing? Could it go back to something? Could it go back to some kind of childhood trauma? Do you often see where there was a case of maybe sexual abuse or physical abuse that might lead to behavior like this later on in life?
Yeah. So I think the tricky part about psychiatric disorders is that it's often quite difficult to point at one causal factor, and we sort of always talk about risk factors. And risk factors for developing eating disorders are I mean, we mentioned environmental, and this would be like if one is brought up in a family that is really conflictual, very harsh family interaction with parents. The other would be like what you've mentioned in terms of trauma. Usually sexual abuse tends to come up a lot. Developmental, adolescence, with all the hormonal changes and the physical changes that come at that time, the psychological manifestations thereof, and pregnancy as a matter of fact as well. That's when we also tend to see a number of people presenting. But the other biggest one is vocational risk, appearing on TV, because appearances are quite big. So that kind of preoccupation might...
For example, the modeling industry.
Modeling industries, athletes.
We've heard that it's rife there.
Yes,
And also, I mean, just, the images we are presented with as perfection by society, by the media, what we see in magazines, the images that we see, is that still playing a big part, though?
Well, not necessarily causal, sure, English. Not as a causal link, but maybe something that would perpetuate the behavior. Because if you do not have the vulnerability, seeing somebody that's thin or does not necessarily automatically then give you that excitement to pursue that, there's going to be some vulnerability, and the vulnerability comes in as a combination of the risk factors that I've mentioned.
It could serve as a trigger to what's underlying there already.
Yeah.
All right. Are you seeing... we often associate something like this with mostly women. We associate it with young girls in particular as well. But just to sort of clarify all of this, it's women, it's men, it's across all race groups and across ages as well.
There's also technicalities involved. Look, women are disproportionately represented, but you do get it in males, and in males largely it's represented in the LGBTQI group. That's where you find disproportionate representation. But in terms of race groups, like if you take our country, for example, South Africa would be very different profile compared to like any European country because of our path in terms of our history, and it lends Caucasian being largely disproportionately represented in the eating disorder because of the high socioeconomic status. Because as much as food is not the cause, but it's a technicality. If you don't have food, you can't binge or purge. That's the technicality that's involved there.
So, Doc, we are all sort of, many of us are very health conscious, we're fitness conscious, we worry, we're particular about what we eat. More and more that's happened over the past couple of years, that's the messages that we are getting about living healthy, living clean. But there is a fine line. When do we know that this has become a problem and obsession? What are the signs that this is now gone beyond that?
So for people that largely present with anorexia, for example, they would have started a long journey of healthy eating. I've learned the term orthorexia, like they eat clean, they exercise, and some families tend to practice that. And in the presence of vulnerability, obviously then that spark other problems. Now when it becomes a problem is, like what I said, when it starts overcrowding other important areas of your life, that you can't go to work without having done your 100 kilometers run in the morning, because that's the routine that you keep to, so you keep your weight down. But the other is sticking to a particular diet, even if evidence is that this is actually making you lose the weight. And because how you introduced it, it's quite secretive. It carries on for a very long time. So the behavior sets in such that by the time people reach out for help, a lot of them takes very long to recover, because the behaviors have set in that long.
So how do you treat something like this? You've run a treatment unit at a hospital. How do you treat? Is this something like drug addiction and alcohol addiction, for example, where the person has to admit, this is my problem, I want to go and get help? Or is it a completely different type of treatment that is involved here?
So I would choose to look at the two groups, say the kids and then the adults. So for kids, for example, it usually is a representation of what is happening in the family. We talk about the family being a system and the child that presents being a symptom of the family. So when you're looking at treatment, you need to treat the whole system, because there's something that precipitated the child presenting like how they are. They might have their own cognitive developments around why they want to stay thin, and it might be triggered by the bullying and the teasing. That needs to be attended to. But the biggest issue is addressing the factors in the family that perpetuates the behavior. And for adults, for example, if there's difficulties in the relationship, or they grew up with the vulnerability, the cognitive aspects of the eating disorder, because the eating disorder, that's where it is in the brain, needs to be addressed. So, and that is probably the most difficult part of the treatment, where they need to undergo long-term therapy. And if they present having lost a lot of weight, that has to take place first in terms of restoring weight to a healthy level before the cognitive aspects can recover to some degree.
We often think of eating disorders and we talk about losing weight like we do, but can it go the other way around, where someone has an eating disorder and just continue to get bigger and bigger and bigger and become unhealthily obese, for example?
So I think you then need to look at what is actually, because it's almost like a pattern of behavior. And you'll find in some instances people will start with a bulimic pattern of behavior, but they end up with an anorexic tendencies, or others start with anorexic tendencies and they end up with bulimia. And you almost need to just track that pattern. And when a person is presenting, you treat what you are seeing as much as you will understand what the person is presenting with.
And can it be cured? Can an eating disorder be cured?
It's a loaded statement. Curing means a lot of things for a lot of people. So curing might be that, you know, you fix the family, sometimes the child just recovers spontaneously. If it's an adult, you just look at what is happening around the adult, because then they need to sort of have something else to live for. So if eating was just what they lived for in terms of just the body shape, you then need to try and find other important areas that the person can live for, and such that the preoccupation with self does not become the issue.
So it's constant work.
Constant work for the longest of time. But there's been recovery, but if it has set in for the longest time, recovery takes long, let's just say.
All right, so we've just, so that's the tip of the iceberg there. We've just touched on it. Thank you very much for that, Dr. Nkokone Tema. Eating disorders is what we're talking about. He is an expert and very involved in treating eating disorders as well. Thank you for your time, Doctor.